Hey, kia ora, Markie here with the camera the wrong way around, back to normal. Happy New Year, although I have posted videos this year, but they've all been silent ones, I think. They've been kind of ASMR, relaxation, landscapey things. So back to demystification, which is what we're all about for the most part, at least. So I, seemingly a long time ago, invited questions on the subject of gender identity, transgender, all those kinds of things. Why did I do that? Because I have a background in that, working professionally in that area. And it's an area that really needs a lot of demystification. There's lots of very funny ideas that people have about that, so I thought I'd throw that one open for questions. So here we go. I've got the screen in front of me with the questions on it. Okay, so I've had 4 questions. So the first one is from Rawiri Storme. So Rawiri is a Maori name, which I'm starting to get my tongue around. I kind of struggled to say it because you've got the R, then the W, then the R. But I did pretty well then, so I might not try and say it again on this video. I might quit while I'm ahead and then go and practice privately. But he says, thanks for covering this. I identify as non-binary. What are your thoughts on NB? And can you talk, being non-binary I presume, and can you talk about the politics of it, please? Oh, blimey. Yes, I can, but yes, kind of worms. Because it's a very controversial, everything about kind of gender identity is really controversial, and people have very, it's very polarized. It's more, even more than kind of normal controversy. It's, very rigid, very militant schools of thought that don't talk to one another in this field. So we'll get on to that. Okay, so JerCess squad said, thanks for covering this. I identify as non-binary. What are your thoughts on NB? I'm going to watch the video very well today. Thanks for sharing. Till the next time again. Okay, so thank you for that one. So to the same question pretty much. And then lots of comments, but not many questions, which is kind of interesting. I think actually you have to know a little bit about a topic before you know what questions to ask, really. And I think it's one of those things that many people just, and particularly in the international community, haven't necessarily come across before. So yeah, so I've had all positive comments. Okay, Jrose Almendrasand has asked, what is the effect of transgenderism, friend? Okay, so that's an interestingly worded question, but I think I can kind of give an answer to what I think you say in there. I should certainly do my best. And then somebody asked about, the legendary Uncle Heavy Gaming. Uncle Heavy Gaming is somebody that supports this channel a lot. So what are the causes of transgenderism? Okay, so they're the questions that I've had. So let's start with those. Okay, so well, first of all, I guess we need to say, what is transgenderism, and should I be using the term transgenderism? Well, bear in mind I have to use kind of terms that everyone understands. And the terminology is quite kind of confusing because there's kind of, I used to work in a medicalised setting. So some of the terminology we used was based on diagnostic manuals and on kind of medicalised thinking. And then there's a different kind of language sometimes that's used among people who identify as trans. So transgender. So to be trans, and this kind of explanation will cover non-binary as well. Okay, but to be trans is to have an identity that, in terms of how you feel, and an identity is how you feel inside, who you feel you are, how you see yourself, how you think of yourself, how you look at yourself, that is different to the gender, so the physical sex that you were assigned at birth. Now, what do I mean by assigned at birth? So what happens is when a baby's born, the doctors look at its bits and say, "Oh, congratulations, Mrs. Blur, it's a lovely baby boy," or "Congratulations, it's a lovely baby girl." But what we found out is really that bits are not what determine gender. So people can identify very differently to what's between their legs. So somebody that's trans, which of course is short for transgender, we used to say transsexual, and that's still the word that's used kind of medically. It's still transsexualism is sometimes is used in kind of diagnostic language. So what that means is you don't feel that you identify with the body that you've been given, if you like, or that you've been born with. So maybe that you were born and considered to be male, but you've never felt male, or increasingly you felt female. Or the opposite way around, or you don't identify as either male or female. So that's the non-binary aspect. Okay, so causes. So I said we'd start with causes, didn't we? I'm racing into non-binary, so we'll come back to that. So causes. So we don't know. There are theories. And I think, the people who are identifying as trans, that the people's gender identity is different now to how it was 5 years ago, 10 years ago, 20 years ago, 50 years ago, 100 years ago, radically. More and more people are identifying as non-binary. There's a theory that kind of explains binary transgender, which is where you've got the sex characteristics of a female, but you identify as male, or vice versa, which relates to the prenatal stages. And one theory is all fetuses are female by default, and then if a baby is going to be male, there is from the mother's body, there is an injection, for want of a better word, or a release of testosterone at two different stages in the gestation period. One reasonably, I can't remember what the actual time periods are. So one is sort of at the beginning, and what that does is it makes the body, virilizes, which is the word, makes the fetus male, makes it start to develop male characteristics. So instead of a clitoris, it starts to develop a penis. Instead of ovaries, it starts to develop testicles. And then there's a second period during gestation where there's another burst of testosterone that comes from the mother into the fetus, and one of the theories is that kind of creates the gender of the brain, if you like. So this isn't proven. So one theory is that depending on what your birth sex is, and whether you had either one or and the fact that you maybe just had one of those bursts of testosterone but not the other. Okay, so what that would mean then, I find it quite hard to explain this just from the point of view of my neurodiversity. I find it quite hard to kind of talk about kind of opposites and things that things that work both ways. just the kind of technical aspect of it scrambles my brain a little, so please bear with me. So what it means is in the case of somebody that's born female but has the second burst of testosterone but not the first, their brain has been made male, so they identify as male. Okay, and in the case of somebody that is born and identified as male, they may have had the first burst of testosterone but not the second one, so their body is male, but the brain is female, if you like. Now that's vastly oversimplified, and I know people get very cross when you talk about male and female brains. It's not as simple as that. It's it's about identity. This is just a theory. I'm not saying that I subscribe to this theory even, but it's just a theory that's there. I think there have always been people who are trans. I think it's I think it's a very real thing. I think and there have always been people that are non-binary as well. But we haven't really had a language for it. And prior to the internet, people living in isolation weren't able to kind of swap notes and say, you know, oh, do you feel like that too? I thought I was the only one. So in terms of cause, that's one possibility. There are all kinds of different theories because there's been a huge increase in people with a trans identity. So up to about, on a graph, up to about 2011 it was like that, and then 2011 the graph went like that. So if it carries on going, everybody's going to be identifying as transgender. So you know, there's definitely, I think with most things there are biopsychosocial elements to it. So I think certainly more people are presenting as, sorry, the sun's doing weird things on my face. Looks like I've got a kind of white beard. The internet, post-internet, people were able to discuss things more. So more and more people are kind of coming forward to gender clinics and places like that for help and for treatment, which is about gender, what they call gender realignment or gender reassignment. Prior to that, I think a lot of people suffer. Well, we know a lot of people suffered in silence. We used to have some people who were, you know, very elderly. They used to come to the clinic, and they used to say that, you know, they'd lived all their lives kind of hiding their trans identity because it, you know, just wasn't understood. They didn't really know where to get help if they did want to get help. They were frightened how, you know, people would react because people weren't as open to it as they are, thankfully, today. So certainly more people are coming forward and more people are acknowledging a trans identity today than, you know, at any point before. Whether that means more people are trans or just more people are coming forward, which also relates to, you know, how we look at gender. You know, I think we've got a much more, which is kind of interesting because we've got a much more flexible attitude around gender now. I mean, when I, you know, was young, there was still, you know, John Wayne was still very big, and there were kind of very definite, you know, gender stereotypes, and they seem to have loosened up an awful lot, really. So that's another element. But the bottom line is, yeah, we don't know. May even be an environmental cause. You know, maybe something. The thing with, you know, people who identify as trans do not have, as a rule, do not have genetic abnormalities of any kind. No more than people that are cis, which means not trans. So it's not an overtly hormonal thing. If there is a physical cause, it's, you know, it's on a much more subtle level. So that's the causes. Long-winded answer, a way of saying we don't know. Testosterone theory is quite interesting. I think, yeah, I won't say any more. I think because it gets vastly more kind of complicated, really. But I think that's kind of a good kind of starting point, really, for an answer. So effects of being trans. So basically, it's quite easy to kind of put yourself in the shoes of somebody that's trans. If you're cisgendered, in other words, if you're not, because you can just imagine that, you know, whatever gender you are, if you're female, just imagine that you were treated as a male all your life, and you're expected to wear male clothes and do male things and talk like a male and think like a male and all the, you know, behave in that way and hang out with other males, and if you did anything feminine, it would be, you know, you would be picked on for it, and vice versa, you know. So that's the effect of it. It makes you feel very uncomfortable, very trapped. One of the terms that we use a lot is gender dysphoria, and gender dysphoria has kind of different meanings on different levels. But dysphoria means distress. So people who are trans, they have social distress because, you know, they're being forced into a world that just doesn't feel right for them, and a way of behaving and a way of dressing and all those things, and people kind of relate to them in a way that doesn't feel right. But also often, you know, a really acutely painful dislike of the certain elements of their bodies, the ones that, you know, define gender. So you know, often, well, not often, but, you know, more often than not. More often than it should be. People were so distressed that they would mutilate the genitals or mutilate breasts and that kind of thing. Be unable to look at themselves in the mirror. Some people, hardly showered because they didn't want to get naked. That's the effects of it, and it's based on, I think, British statistics or certainly European statistics. There's a 20% higher suicide rate among pre-treatment trans people than there is among the cis population, which is phenomenal. So it's a dangerous business being trans. The level of distress is such that the suicide rate is massively, appreciably higher. Now for some people, gender identity, you can be gender incongruent. You can have a gender identity which is different to your birth gender, which is your birth sex, I should say, and that can cause you great distress. You can have gender dysphoria, but you can also have a gender identity that doesn't fit with your birth sex, but actually be comfortable with that and find a way of either expressing it or not expressing it, but accommodating it and living with it. So there are lots of people, I think, that wouldn't present to a gender clinic for any kind of medical interventions to adapt their bodies to be more congruent to the gender that they feel inside, because they can kind of deal with that. But lots of people have the gender dysphoria, the distress, and they're the people that kind of come forward for treatment. So those are some of the effects of, if you like, I think that was the question, effects of transgenderism, which isn't really a word that's kind of used, but we're using all kinds of words here to kind of get the message across, because I'm aware I'm talking to people from different cultures and different languages and stuff like that. So going back to the non-binary thing, okay, and what do I think about that? Okay, this is where I will be a little bit controversial. And this is based on clinical experience and reading. I think there have always been, I think non-binary gender identity is a very real thing, and I think there have always been people that have it. I think a lot of people who are presenting as non-binary today are, and I'm not saying everyone, and I've really kind of no idea of the kind of proportions, but there are certainly some people who, in my clinical experience, begin by identifying as non-binary, and then over time start to find that they identify more strongly with one gender or the other. I've come across people who, quite militant people, activists for non-binary gender identity, who've obviously identified as non-binary, and then over time I said, oh no, actually I'm female, or a male. So most people that identify as non-binary are assigned male at birth, and there's lots of things, and this is where the politics gets very interesting, because for example, there are radical feminists out there who think, radical lesbian feminists who think that trans men, which is people who are assigned female sex at birth but who identify as male, and particularly non-binary people, are just confused lesbians. And they've actually kind of sometimes gate crashed trans conferences and events, and tried to kind of very aggressively put that view forward. I think one of the things that I'm becoming aware of more and more and more is that I think people have a lot of confusion around identity, not just around gender. And often people that are confused, that don't have a very clear sense of who they are. Often people are on the autistic spectrum, because there's a huge correlation between autism and people who identify as gender incongruent, who are autistic, on the autistic spectrum, which I think can bring confusion around identity anyway. So I think some people, and the people that tend to identify most as, and I suppose when I'm kind of talking about these things, I'm basing this on the work that I did in the UK in the gender clinic. So, it might be a different situation in different countries, different cultures. But the majority of people that presented as non-binary were very young. We saw people from 17 upwards, and often they were between 17 and 22 for the most part. And I think identity is not very clear at that age. The brain hasn't actually finished developing until about 25. So I didn't know anything when I was that age. I don't know much now, but it's a scary age to be making irreversible decisions. So while I respect non-binary gender identity, if somebody has non-binary gender identity and they're thinking or wanting to make irreversible physical changes to their body, I think I would advise great caution, really. And although the gender dysphoria can be terrible and can be horrible, it's better to kind of work through that. And I would say, get a therapist or a counsellor, a specialist therapist or a counsellor. Now, and I'm very, very careful here, I'm not talking about conversion therapy, which I think is terrible and is illegal. What I'm talking about is somebody that you can talk to, that's not going to lead you in one direction or the other. It's just going to give you the opportunity to reflect with the benefit of another person who has no agenda apart from your well-being, so that you can discuss what's going on and how you're feeling, to the point where you feel clear, where you feel a definite clarity, whether that be that you identify with the gender that you were assigned, or the sex that you were assigned at birth, or whether you feel that you need to go through a transition, or whatever that might be. But the only important thing is that you get to a point where you're clear and you're happy, and the actions that you take will be ones that will be beneficial to you. So non-binary is real. But I think my kind of sense is that there are a lot of people that identify as non-binary that aren't non-binary, and that given time and the opportunity to reflect, may find that their gender identity settles in a different place ultimately. Okay. And I know that view will offend somebody, because everybody gets offended in gender, but and that's not a stick I use to beat people with, absolutely not. If somebody identifies in a certain gender, I will respect that, and I will use the pronouns that they wish to be applied to them, and address them in the way that they wish to be addressed, and honour their recognised gender identity. But if I'm working with them therapeutically, I'll also give them an opportunity to freely explore and gently reflect on all of that, really. So that's kind of my worry, really. Lots of young people going through medical processes that they may well live to regret in the medium to long term. Now, non-binary is an umbrella term. It covers all kinds of things, including things like gender fluid. There's a whole range of different terms that people use. So non-binary, some people feel that they're neither male nor female. They are a mixture of male or female. Gender fluid people feel that they fluctuate between one gender identity and another. And it's interesting because I think the term transvesticism, which I find very hard to say, seems to have almost gone out of use these days. And I suspect that a lot of people that identified as what they used to call dual role transvesticism are now actually saying, oh yeah, I'm non-binary. Which is, I think, probably a more comfortable and socially acceptable label. I think with transvesticism, there were two kinds of transvesticism. One is a sexual fetish. So it used to be called, I think it's still called fetishistic transvesticism, which is where it's just a paraphilia where somebody puts on a pair of knickers and that's their thing. which is, and I'm not knocking that or being disrespectful about that, because, I think there are all kinds of paraphilias and fetishes, and as long as nobody's being harmed, it's all good. So, and sometimes, people who, would have identified as transvestites would maybe live in a male role for the bulk of the time, but then, once in a while they would adopt a female persona and wear female clothes and put on makeup and wig and things like that, and then go out as female. Now, so there's two different types. That's the dual role, and then there's the sexualized. And I think transvestites have always had a tough time. Really, I think people are much more suspicious of transvestites than they are of people who are transgender. I think transgender people generally, I've heard some horrible tales of discrimination and prejudice, but I've heard more tales of, really, really good acceptance, really loving acceptance. So I think people have always kind of, by and large, I'm talking very broad terms here, accepted people who are transgender probably more than people who are transvestite, because they can kind of get their heads around transgender, but not around transvesticism. They think, well, and is that person kind of pretending? I think that's what people don't like, is they don't like the idea that somebody might be pretending to be something that they're not, whereas somebody that's transgender is not pretending to be something that they've been pretending to be something they're not most of their lives, against their will. And when they start to express themselves in the gender that they identify with, that's when they feel like they're being the most congruent and most honest and authentic and true. So so in short, they're non-binary, an umbrella term. So why we call it non-binary? Well, binary means two, one thing or the other, and this is where some people are very rigid and they say, there are only two genders, as male or female, blah, blah, blah. So that would be the binary view. Okay, so binary transgender means that you're born with one, but you feel like the other. Non-binary means that it's not as simple as that. It's not, you're not seeing things as one moving from one thing to another, or if you know what I mean. That's kind of shorthand, really. They're seeing that there isn't a gender binary. That it's there are many shades of grey in between the black and white of male and female, and that it's perfectly okay, as I totally agree, to occupy that space in between. But I think the thing with people that are that identify as non-binary is they may have there's probably a wider scope of different experiences that come under that term. So if you had 6 people in a room that were identifying as non-binary, and you kind of asked them about how they felt and their experiences and what they meant by that, they might say very different things potentially, which is okay. That doesn't it doesn't lessen the validity of it or take anything away from it, but it just expresses the fact there are different points on the scale of grey, I guess, if you like, and some people will be moving up and down that scale of grey, and sometimes we describe it as a scale of blue and pink, which is another kind of way of looking at it. So the politics, so I've talked a bit about the radical feminist lesbian kind of side of things. Of course, you've got the kind of the Christian right that I think all this is an aberration. Aberration? Is that the right? No, aberration. Oh, I don't know. They think it's not right, and they think that for some reason God's not going to be happy about that. Which I find that very hard to understand. Really, I can't really see whether there's any sort of biblical rationale really for why that would be a bad thing. It's to me it's transgenderism, and I don't usually use the term transgenderism, but it's not, you could argue that it's a difference, not an abnormality or a disease, but from a medical perspective, because people often feel the need for physical treatment to change their body in order to resolve how they feel, then it's looked at as a medical issue. And for me, if you're born with a physical deformity, if you're born with a huge tumor, a huge cyst on the side of your head, then very few people would make any argument for why that should not be medically removed to make that person feel more comfortable, and even if it's not life-threatening or causing any physical threat to them. It's impairing their life, it's making them feel self-conscious, it's not how they want to be. So they undergo surgery and treatment to remove it. And I really don't see why treatment for gender dysphoria, distress at your gender, should not be treated medically. But the religious kind of far right kind of, and I've done some of the videos where I've touched on a model called the 5-factor personality model, or the Big Five personality model, which explains some of the psychology of why people can sometimes hold that very rigid view. So that's one side of the argument. The other side of the argument is there are people that are kind of very militantly non-binary, who aren't really up for too much of a dialogue about that. They feel very under siege. They feel that the world is discriminating against them, and there's a lot of kind of militancy and anger around that, which is kind of understandable. But it also makes them makes it hard for progress to be made, really, because we've got to talk about this stuff. So you've got three camps really there, I guess. You've got the militant non-binary camp, you've got the Christian far right fundamentalist camp, you've got the radical feminist and often lesbian, not necessarily all lesbian, camp that's there as well. And then you've got people like myself that have a very open mind, that kind of think that really ultimately this is about people. It's about treating people well, giving people what they need, being respectful of people, and trying to get to a strong evidence-based understanding of what's going on, a clear understanding of what's going on in a very, very complex issue. So biopsychosocial, biological, psychological and sociological, so the environment that you're in, the time and the evolution of humanity, where we are as a society, as a culture, that's the sociological or social part. Biological part would account for like that testosterone in the womb theory that's going on, and bio, that it seems to be a physical thing. It's not something that's identified as a mental or psychological disorder. So I'm talking about gender incongruence. So I use a lot of terms here, and I hope I haven't just kind of thrown them in and thrown you with them, really. So gender incongruence is one that I quite like. So it means that your gender, your sense of gender and who you are isn't congruent, doesn't match with the bits that you've got on the body that you've got, and the social role that you've been kind of obliged to play. So gender dysphoria is when we talk about the distress. Gender identity disorder is another term that's used. And I guess some people would object to the disorder and say that it's a difference. And I can kind of certainly understand that view. I think in order for people to receive treatment and surgery for something, you have to kind of make it a disease. Otherwise, money doesn't become available. Somebody has to have a kind of a disease before a doctor can kind of treat them. So you have to kind of, on a medical level, you have to kind of use words like disorder, really. Otherwise, you're giving medical treatment to somebody that's perfectly healthy for no good reason. So. Minefield of a subject. What I probably should have done is done a more introductory video before this, and I'm quite happy to do that, or ask more questions. So if I've offended you, I'm sorry. It's certainly not my intention. Or if you have a radically different view, that's absolutely fine. We need to be talking to people with. I'm kind of very rational and somewhere in the middle, really. So I don't, I'm probably not gonna. I'm not, certainly not at one of the extremes of this argument. But if you have a different view and you want to, talk about that, and please leave a comment. We love different views. Just be nice, be polite. I think this is the thing, is nobody, people these days, not just in this field, but in all kinds of things, are forming kind of extreme little groups, and there's no dialogue anymore. People aren't talking to each other anymore, and people aren't being respectful anymore, and people think that if somebody thinks differently to them, then they're an enemy, and that's not achieving anything. We all need to talk to each other in this, particularly around this issue, and get out of our little kind of camps. So I hope that's made sense and not been too much of a kind of psychobabble ramble. And tell me what you think. If you like it, please hit the like button. If you don't like it, hit the like button anyway, because it's nice and it helps me, helps our channel, helps us get the message out for a lot of things that we like to talk about. Because I think, even if you disagree, this is a subject that we need to talk about. We need to talk and we need to listen. So leave a nice comment, leave a like, sign up on Patreon if you really want to support us, subscribe if you really want to support us, and thank you very much for watching. Rawiri.